So today I want to ask a question, a topical question. Why is our women still dying in 2026 and beyond? Why? Despite the promise, or rather, I don't want to use the word promise, but despite the target by SDG, Sustainable Development Goals, that they want to see if they can reduce maternal mortality by less than 70 per 100,000 live birth. The maternal mortality is defined according to WHO as the death of a woman whilst pregnant or within 42 days after termination of pregnancy or delivery from any cause related to aggravated by the pregnancy or its management, excluding accidental or incidental causes. According to Nigerian Demographic Health Survey 2024, through 2025. Okay, the figure still staggers around for maternal mortality. They are still mentioning that it is still around 512 to 576 deaths per 100,000 live birth. So if you want to compare this to the target of less than 70, you can see that it's still a far cry. And let me now shock you. The target is that less than 70 per 100,000 live birth is being targeted to be achieved by 2030. This is 2026. So the question is that why is our women dying? Basically, for maternal mortality, there are basically either a direct cause or indirect cause. We'll just talk about the issue of how to prevent the direct causes of maternal mortality. We use the acronym HOSEA, hemorrhage, obstructed labor, the sepsis, then eclampsia, preeclampsia, then abortion complications. All right. So why are women dying? Let's look at the prevention. How can we prevent maternal mortality, especially in Nigeria? Which is quite topical, and of course, these figures are not getting better. They are increasing by the year. Now, prevention is usually primary, secondary, and tertiary. The primary usually where we talk about the issue of we are awareness campaign, awareness campaign. Now, if a woman is informed about the possible thing that can kill her, I believe that no woman is a tree. If you know that somebody wants to kill you, you have to move. So when you are aware that bleeding can kill you, especially when you are pregnant, that it can kill you, and you should know what and what when you are bleeding. I mean, everybody knows when they are bleeding, and being empowered to move when you are bleeding. You hear a situation whereby some women might be bleeding, they need to get approval from the husband before they can get to hospital, or they are not even empowered enough to have some money to go to the hospital, or there might not be an ambulance to pick up from the hospital and all that. So all those things should be looked into, awareness, to know when, during that, if once you see bleeding of any kind, you must get to the hospital. All right. Now, for the issue of obstructed labor, I mean, when a woman should know when she's in labor. How do you know that you are in labor? Very important. Several women ask me this question when they are pregnant. Usually, when the you are in labor, the pain, the abdominal pain that the woman feels is different. You have those pain that comes and goes, rhythmic, painful. The pain worsens. As each one comes, it comes and goes, it comes again and goes, it comes again and goes. It becomes imperative for you to get to the hospital. Or when you rupture your membrane, you have your water breaks, you must get to the hospital. And of course, when you find what we call show something that looks like a mucous membrane, you must get to the hospital so that they can have what we call early diagnosis of labor. Very important, so that to obviate the issue of obstructed labor. For sepsis, it's important to know that delivery in dirty areas, having your delivery in places that are not assigned, that did not meet the minimal standard. And of course, there is no skill head attendant. So you hear some people deliver in some places, very odd places, and they say that they will be praying while they are there. No, you don't do that. It's either in the hospital that has the minimum standard, then that should remove or reduce the mortality that can kill the woman, okay? Or delivery through people that are not qualified. I don't have certification for deliveries. So what we call the non-skilled but attendants. Women should know when to deliver, and of course have the ticket, or rather the direct ways of meeting these people, or even talking to these people, or reaching these people, their caregivers, especially when it comes to delivery, is important. Right now, for sepsis, it's important to know that over the counter antibiotics is not very good. Some women are, they have this thing of they have vaginal discharge, they go and buy antibiotics and take, and so by the time the woman actually needs the antibiotics, it becomes pretty difficult for the woman to get what that care that she looks for. There will be a lot of resistance to antibiotic therapy. For eclampsia, pre-eclampsia, now we talk about the issue of checking blood pressure before, during, and after. So even when you are pregnant or not, it's important to have the habit of checking blood pressure. Pregnancy can induce hypertension, and a woman that is hypertensive can become pregnant, and that pregnancy might even worsen and become complicated, leading to what we call preeclampsia, eclampsia, a woman fitting in labor. It's important to check this. And of course, the issue of abortions. Um, Fortunately, unfortunately, Nigeria is still under the strict abortion laws. Nigeria, you cannot just walk into a clinic and say you want to get an abortion, and you'll be offered. Anywhere you see this being done, it is criminal. So the only time that an abortion can be, accepted or endorsed by the woman is when the continuance of such pregnancy can lead to the death of the woman. Then you need two obstetricians in good standard to take that decision for the woman to have an abortion done. So that means that other abortion that is not legal, or that is not certified, or that is not endorsed, that is not fitting into this category, the women will look for places where they will get the abortion done, especially when they are pressed. They really want to get it done. They have quacks, and from there they have complications. All right. So we have talked about the issue of hemorrhage, knowing when one is bleeding, obstructed labor, sepsis, and of course abortion, and preeclampsia, eclampsia, hypertension, pregnancy. These are the cardinal ones that can lead to, so for the secondary prevention, it's important that when a woman gets to the hospital and the hospital should be equipped to take those emergencies. There should be blood banks, or within at least 3 kilometer radius of blood banks that can easily be grouped and cross-matched, and the woman get blood transfused. We may have difficulty with some religious sects, but that will be managed by consultants, and of course, a woman should, mention this upfront so that to know how this can be managed. All right. It's important to also have the skills, in those hospitals that can immediately have what we call a a very quick recourse to a hysterectomy or removal of the womb if the bleeding becomes recalcitrant and it's not stopping. So this can be done because it can actually be life-saving. All right. So preeclampsia, pre-eclampsia, is important that hospitals should be equipped with emergency drugs, emergency antihypertensives, so that these women can have this as soon as possible and it can actually be life-saving. When abortion has already occurred and there is sepsis, the woman should get care with potent antibiotics. All right, you can see what is happening in Nigeria about fake drugs. The government is trying their best to see how to reduce the scourge of fake drugs in Nigeria. So there is still a lot to be done, because if you don't get the right drugs, you'll be hitting the organism, and the woman will not get, will not be healed, and you are still trying to treat. So potent antibiotics and also light. We talk about the issue of light every time. We are still talking about the issue of light in Nigeria. Some of them might need cold chain. Some of them has to be, not necessarily cold chain, but at least put at a particular temperature based on the execution from the pharmacy. So that is very, very important to be done. So, and also the skill, for instance, for when there is abortion, having what we call monobac masculation skill to do it well without necessarily causing rupture of the uterus is also, so that's why you need the skill, people that are trained and trained. Today we have, Nigeria is scourged with people living, going abroad because, of course, the obvious reasons. So more doctors should know what to do, and especially how to treat these illnesses. ICUs should at least be in strategic places, because sometimes sepsis can become so bad that it needs ICU care, and of course we should be able to have one. And of course, where you need surgery or drainage of pus and all that, that should be skilled labor to do that. So for rehabilitation, now rehabilitation will involve that for a woman who has had what we call Sheehan syndrome, might have difficulty in breastfeeding. One should remember that possibly because of the postpartum hemorrhage, such a woman will need care or support in terms of breastfeeding. A woman who has had obstructed labor, that of course we are just coming to you for the first time, we couldn't be able to get her cancelled along the line, that such a woman will benefit from VVF repair if VVF has already, that is vesical vaginal fistula or other fistulae has occurred. Such a woman will need repair, among others. And for hypertension in pregnancies, we don't just discharge home. Of course, we have to transfer to the cardiologist to continue management and all that. And of course, for the women who has abortion, that criminal abortion, they have to be counseled, extensively on the importance of having responsible sexual intercourse, and of course, trying to talk about the issue of modern day contraception, and of course, limiting getting pregnant, especially when they are not even married and all that, to reduce social burden. The factor of maternal mortality in Nigeria is multifaceted, and of course, most of sub-Saharan Africa. But go one, go two, go three, go four, we're talking about the issue of poverty, reduction of hunger, the issue of the health for all, and of course the education, especially among girl child. We should be able to, along the line, curb maternal mortality to a reasonable extent. Of course, political will is very, very important in Nigeria, where the upper house and lower house should look into critical bill that should be passed so that it can reduce maternal mortality, get our hospital to international standard, train doctors with good remuneration, reduce the issue of brain drain in Nigeria, among others. I believe by the time we put everything, and hospitals are well stocked with monitoring and of course getting all they need, I believe that should be able to reduce maternal mortality. See you in the next video. Thank you very much. Please like, share, and let people know how we can help Nigeria grow.